I want to break down some pharmacy secrets here in a plain English. Hello, it's still your friendly neighborhood pharmacist. In today's video, I want to be answering 7 top questions I get asked as a pharmacist. You probably might have googled it too, so let's dive in. So, my number 1 top question is, for this question now, it depends on the class of drug. Let's take for example the metronidazole. And many people do not know that metronidazole, the popular drug we call the flagyl, is an antibiotic. Yes, they call it common flagyl. It's an antibiotic. Take for instance, combining that drug with an alcohol, there's what we call the disulfiram reaction that occurs. So let's keep that aside. Imagine combining metronidazole with alcohol. Do you know what it can cause?
No.
It can cause severe nausea, vomiting, stomach cramp, flushing, and it can even cause rapid heartbeats. That is just for metronidazole. Imagine combining alcohol again with sedative medications like diazepam, those drugs that make one sleep. It can dangerously stop your breathing. So my quick tip for you is to always read the leaflet label of any medication you buy, or ask your pharmacist. And if you are asked, do not take with alcohol. Please kindly avoid that. And the top second question I get asked is this: if you remember soon after, take it. But then, if you remember close to the next dose, wait for the next dose to take the medication. But then, never double the dose. Let me explain it the way you understand. If your medication is to be taken 8 a.m. and 8 p.m. and you forgot, you remembered like 9 a.m., take it. But if you remember that you've not taken your medication for 8 a.m. by 6 p.m., there is no need. Leave it for 8 p.m. to take the next dose. But don't go ahead and double the dose. If you're to take 1 tablet, don't take 2 tablets.
Let's go.
But then, my candid advice to you is, if you are the type that forget your medications easily, use a reminder or a pill box to stay on schedule. Here comes my third question. And if you're among those that do this, please, not with an antibiotic or blood pressure medication or with an antidepressant. Do you know why?
No.
Stopping some medication so early can cause relapse and even resistance. Just imagine, when you fight someone, the weaker bugs die first, leaving behind the stronger ones. Imagine stopping your antibiotic early enough. The weaker bacteria will go off. You will knock them off, leaving behind the stronger ones. With time, they become resistant to the medication. Here comes the fourth question. From this question, what I'll tell you is that it depends. Let's take for instance, calcium and iron supplements can actually block drug absorption. So in this case, you are advised to take 2 to 4 hours apart. And you know what? Natural does not always equal safety. So before you take any medication, open up to the pharmacist, tell them every supplement you are taking so that you'll be educated properly on how to use your medications. And this is the number 5 question I get asked. Please, never assume anything. Some OTC code medication reduces placenta flow, and even some sedatives can pass into the breast milk. So always ask questions so that you be clarified on what to use and what not to use, either pregnant or as a breastfeeding mom. Paracetamol you see is generally safe, but you see NSAID is off limits. And here comes the sixth question. You see, this particular question is generally challenging, especially if you are in the community practice. When we talk about generic have the same active ingredients, but may differ in color or shape. For instance, paracetamol, we have a round shaped paracetamol, we have a caplet shaped paracetamol, we have white color, we have cream color, we have capsule paracetamol. All of these are paracetamol, but people keep asking, or people get confused when they come to refill a prescription or buy a certain medication, and it's not exactly the same. And if you are always in doubt of any medication, please do check the label, or better still, snap the picture of your usual pill so that it will ease the problem for you and the pharmacist. Do you see this number 7 question? I hope you've seen it. Yes, you do have to finish your antibiotic medication. Do you know why?
No.
Stop it early. Leave the strongest bacteria behind, thereby creating a super bug. Although some new guidelines allow a shorter course. That is, if only your doctor says so. Otherwise, finish your medication, your antibiotic medication. A little bonus buster. Just to let you know, probiotics isn't mandatory after every antibiotic treatment, because people also keep asking. It is not mandatory. You can add it if you experience GI upsets. So if this helps, give this video a thumbs up, hit the subscribe button, and don't forget to drop your number 8 question. I may answer it next. Thank you for watching, and see you in my next video. Bye.